Thank you. I now call Matt Rudder.
Thank you, Sir Mark, and it's a pleasure to serve under your chairmanship. And may I also thank the Honourable Member for Hammersmith for his work in securing today's debate, and indeed thank members from across the House for their contributions. I would like to support the points my honourable friend makes. I think he has clearly set out in his speech a great deal of local need and hope for a solution to be found in his area, and indeed other members have. And today I would like to add my support to them, and also to highlight the very similar issue at the Royal Berkshire Hospital in Reading, which serves both Reading and a very large part of the Royal County of Berkshire. I'd like to start, Sir Mark, if I may, by paying tribute to the staff of the NHS in our county and across the country, of course. They are extremely hard-working. They've been through the pandemic and many other great difficulties in recent years, and they deserve our respect and our support. And this programme of rebuilding is obviously part of that. It's investing in the future of the country and indeed in the health of our population. The Royal Berkshire Hospital is one of 40 hospitals which were originally identified by the government for rebuilding, but sadly, when an announcement was made by the Department of Health recently, it wasn't mentioned. And you can only imagine, the public can only imagine, and colleagues here today can only imagine, the stress that puts staff under, and indeed patients who are waiting for a resolution to many serious building problems in our area. And I do hope that the Minister, when he speaks later, will address that point. The hospital now, sadly, as my honourable friend mentioned earlier, risks potentially missing out because the pot of money available could, if the government's plans and assumptions are correct, run out in 2030. And as of yet, there's no date for work to start at the Royal Berkshire Hospital. The issues at the hospital are quite clear. They're very similar to the ones in London and indeed across the country. The old part of the hospital, the North Block, is 173 years old. The site is a patchwork of buildings from different dates since then. A&E isn't suitable. There's a £200 million backlog of repairs, all very similar to the situation my honourable friend mentioned in West London, which obviously is very nearby. And there are many other issues. All of this affects the productivity of the hospital, the experience of patients, and also, to some extent, the morale of staff. And I have had a number of staff, many of whom I know or who have contacted me, who have expressed concerns over some months and years about this issue. So I do hope that today the Minister will be able to clarify the position for these 40 hospitals, both for the position in London in this particular case, and indeed around the country in Reading and many other areas. And I hope as a result he'll be able to reassure both patients and staff and give the country the certainty that it needs. Thank you, Sir Mark.